Ear pain plus blurred vision. Don't ignore this warning sign. Have you ever felt a throbbing pain in your ear that seems to pulse along with your heartbeat? What if I told you that this pain, when accompanied by blurred or hazy vision, could be your body screaming an alert about something much more serious happening in your blood vessels? How many times have you ignored these signs, thinking it was just fatigue, stress, or a simple headache? What would you do if you knew that this specific combination, pulsatile ear pain plus visual disturbance, could indicate a vascular condition that affects millions of people over 45 years old? Today, I'm going to reveal why medical specialists in vascular neurology consider this combination of symptoms one of the most important warning signs you should never ignore. Keep watching, because your health may depend on this information. When we talk about ear pain accompanied by visual disturbances, we're facing a complex phenomenon that involves the intracranial circulatory system. This condition, technically known as idiopathic intracranial hypertension, or pseudomur cerebri, represents an increase in pressure inside the skull that can cause permanent damage if not properly treated. The mechanism is both fascinating and concerning. When cerebrospinal fluid pressure increases, it compresses delicate structures of the central nervous system, including the auditory nerve and optic nerve. This explains why you might feel that characteristic pulsatile pain in your ear. It's literally synchronized with your cardiac pulse. The discovery of this connection between auditory and visual symptoms dates back to the pioneering work of Dr. Heinrich Quink, who in 1891 first described the lumbar puncture procedure to measure intracranial pressure. Decades later, in 1947, Dr. Walter Edward Dandy established the diagnostic criteria for what we now know as idiopathic intracranial hypertension. But here is what most people don't know. This condition is not as rare as previously thought. Modern research shows that its true incidence may be underestimated due to inadequate or delayed diagnosis. A groundbreaking study conducted by Dr. Michael Wall at the Department of Neurology at the University of Iowa, published in 2014, followed more than 1,600 patients over a 5-year period. The researchers used rigorous methodology that included intracranial pressure monitoring through lumbar puncture, advanced neuroimaging examinations, and detailed ophthalmologic evaluation with papilledema measurement. The evaluation protocol established by Dr. Wall included precise measurements of cerebrospinal fluid pressure, which should normally remain between 140 to 180 millimeters of water. In cases of intracranial hypertension, these values can exceed 300 millimeters of water, creating pressure 3 times greater than normal on delicate neurological structures. Preparation for diagnosis involves a specific sequence of examinations that must be rigorously followed. First, magnetic resonance imaging is performed to rule out space-occupying lesions. Next, lumbar puncture is performed in lateral position, with the patient in left lateral decubitus, knees flexed toward the abdomen. Initial pressure measurement is crucial and must be taken before any fluid withdrawal. But what we discovered next will completely surprise you. Let's consider the case of Margaret Thompson, a 52-year-old teacher from Des Moines, Iowa. In March 2022, Margaret began experiencing episodes of pulsatile pain in her right ear, always at the end of the day, after long hours grading papers and preparing lessons. Initially, she associated the symptoms with fatigue and work stress. "I thought it was just the result of spending too much time looking at papers and screens," Margaret recalls. But in April of the same year, something changed dramatically. The ear pain became more intense and began to be accompanied by episodes of blurred vision lasting between 15 to 20 minutes. For 6 consecutive weeks, Margaret visited 3 different doctors. The first prescribed antibiotics for a supposed ear infection. The second suggested she needed new glasses. The third recommended migraine medications. None of them considered the possibility of an intracranial vascular condition. It was only when Margaret developed severe morning headaches accompanied by nausea that she sought emergency care. There, Dr. James Mitchell, a neurologist specializing in intracranial hypertension, immediately recognized the symptom pattern. The combination of pulsatile ear pain, visual changes, and morning headache is a classic warning sign, explained Dr. Mitchell. Examinations revealed that Margaret had an intracranial pressure of 340 millimeters of water, nearly double the upper normal limit. Her optic nerve showed signs of significant edema, and hearing tests confirmed mild conductive hearing loss due to pressure on middle ear structures. Do you recognize any of these signs in your own experience? Perhaps you've noticed that your ear pain worsens when you lean forward or when you cough. Or maybe you've observed that your vision becomes blurred, especially in the morning or after periods of physical exertion. These are exactly the types of subtle signs that many people dismiss as normal or related to aging. But think with me, when was the last time you really paid attention to the signals your body is sending? That pulsating sensation in your ear that coincides exactly with your heartbeat isn't normal. Blurred vision that appears and disappears without explanation isn't just tired eyes. Can you imagine ignoring a fire alarm in your house? Then why would you ignore the alarms your own body is sounding? When these initial symptoms are ignored, the progression can be devastating. Continuously elevated intracranial pressure can cause permanent damage to the optic nerve, resulting in irreversible visual loss. In more severe cases, there may be development of secondary hydrocephalus, requiring immediate neurosurgical intervention. Consider the case of Robert Chun, a 61-year-old software engineer from Seattle, Washington. Robert experienced similar symptoms for more than 8 months before seeking specialized medical help. During this period, he progressively lost peripheral vision in both eyes and developed constant ear ringing. "I've been working with computers for more than 30 years," said Robert. "I always thought my visual problems were occupational. I never imagined they could be related to pressure in my brain." When finally diagnosed, Robert had already lost 40% of his visual field, a loss that unfortunately cannot be reversed. Robert's experience perfectly illustrates why early detection is crucial. Unlike many neurological conditions, idiopathic intracranial hypertension can be effectively treated when identified in early stages. If you've made it this far, pay close attention now. What I am about to share could be the difference between maintaining your vision and hearing intact, or facing irreversible complications. The treatment protocol, developed by Dr. Susan Bruce at the Neuro-Ophthalmology Center at the University of Pennsylvania, has demonstrated remarkable results. Between 2019 and 2023, her team treated more than 400 patients using a multidisciplinary approach that combines medication, lifestyle modifications, and when necessary, minimally invasive procedures. Patient Sarah Williams, 48 years old, came to us with symptoms identical to those we're discussing, reports Dr. Bruce. Pulsatile pain in the left ear, episodes of blurred vision, and morning headaches. After 6 weeks of treatment with acetazolamide at a dose of 1,000 milligrams per day, combined with a low-sodium diet and specific exercises, Sarah experienced an 80% reduction in symptom intensity. The specific protocol used by Dr. Bruce's team includes several carefully sequenced steps. First, acetazolamide is administered, a carbonic anhydrase inhibitor that reduces cerebrospinal fluid production. The initial dose is 250 milligrams twice daily, gradually increasing until reaching the therapeutic dose of 1,000 to 1,500 milligrams daily. Simultaneously, a sodium-restricted diet of less than 2 grams per day is implemented, as excess sodium can exacerbate fluid retention and increase intracranial pressure. Specific neck strengthening exercises and diaphragmatic breathing techniques are also incorporated to improve cerebral venous drainage. In cases more resistant to medication treatment, procedures such as lumboperitoneal shunting or optic nerve sheath fenestration may be necessary. These procedures, performed by specialized neurosurgeons, create an alternative pathway for draining excess cerebrospinal fluid. The results are often dramatic. Patients report significant reduction in ear pain within 2 to 3 weeks of treatment. Visual improvement may take a bit longer, but studies show that 85% of patients experience some degree of visual recovery when treatment is started early. But the benefits extend far beyond resolution of immediate symptoms. Proper treatment of intracranial hypertension can prevent development of secondary complications, including sleep apnea, which is significantly more common in patients with elevated intracranial pressure. Recent research conducted by Dr. Michael Sinclair at the Institute of Neurology at the University of Toronto revealed that idiopathic intracranial hypertension may be associated with sleep disorders in up to 70% of cases. When we effectively treat intracranial pressure, we frequently observe dramatic improvement in sleep quality, explains Dr. Sinclair. Additionally, there's a strong correlation between intracranial hypertension and metabolic syndrome. Proper treatment frequently results in better weight control, reduced insulin resistance, and improved cholesterol levels. Can you imagine what it would be like to wake up without that throbbing pain in your ear? What would it be like to have sharp, clear vision again, without those frustrating episodes of blurriness? What would it be like to sleep deeply, without interruptions caused by headaches? Visualize for a moment how your quality of life could be transformed. Imagine being able to read without discomfort again, drive with confidence, and fully participate in activities you may be avoiding due to your symptoms. However, it's crucial to understand that there are specific situations where this treatment may not be appropriate. Patients with advanced chronic kidney disease, those with a history of recurrent kidney stones, or individuals with known allergy to sulfonamide medications should discuss therapeutic alternatives with their doctors. Additionally, it's important to recognize that acetazolamide can cause side effects, including tingling in extremities, taste alterations, and fatigue. These effects are generally temporary and diminish over time, but require careful medical monitoring. Follow up with neurologists specializing in intracranial hypertension is fundamental. These professionals have the necessary experience to adjust dosages, monitor treatment response, and identify any potential complications early. It's important to understand that not every ear pain combined with visual changes represents intracranial hypertension. Other conditions, such as vestibular migraine, trigeminal neuralgia, or even brain tumors, can present similar symptoms. Therefore, complete medical evaluation is always necessary. Always keep in mind that knowledge is power, but knowledge must be applied responsibly and under proper medical guidance. If you recognize the symptoms we've discussed, don't hesitate to seek qualified professional help. Reflecting on everything we've discussed, it's clear that the combination of pulsatile ear pain and visual changes represents much more than isolated and inconvenient symptoms. These signs may be the key to diagnosing and treating a condition that, when properly managed, offers excellent prognosis. Modern medicine offers us extraordinary tools for diagnosis and treatment of these conditions. Advanced neuroimaging techniques, specific medications, and minimally invasive procedures have made it possible not only to effectively treat intracranial hypertension, but also to prevent its most serious complications. Looking to the future, promising research is exploring new biomarkers for early diagnosis and even more precise and effective therapies. The medical community is increasingly recognizing the importance of a multidisciplinary approach that considers not just immediate symptoms, but also the impact on the patient's overall quality of life. Always remember, your symptoms are real, your concerns are valid, and there are dedicated professionals and effective treatments available. Don't let fear or uncertainty prevent you from seeking the help you deserve. If you identified with any of the symptoms we discussed today, leave a comment sharing your experience. Your story could help other people going through the same situation. Share this video with family and friends who might benefit from this information. Subscribe to our channel to receive more content about auditory and neurological health. Turn on notifications so you don't miss our upcoming videos about warning signs you should never ignore. Your health is your most precious asset. Don't wait until tomorrow to take care of it. Start today by taking the necessary steps to protect your future.